For this next video, we're going to be doing the rotator cuff of the pelvis, the deep rotators of the pelvis that are going to help stabilize the sacrum and the iliac bones. For anybody who has any sciatica or piriformis syndrome, this would be a great therapeutic exercise to start off with. Lay flat on your back with the back of your hands on the ground, pushing evenly through all 5 fingers on each side to help engage the extensors, the triceps, and the posterior rotator cuff. Your heels should be a little bit further away than a normal bridge setup. You're going to flex the feet so the toes come up towards the knees. You're going to make sure that your ribs aren't extended. You want to keep it nice and neutral. To start off, you're going to breathe up into the chest. On the exhale, you're going to pull your abdomen in to help set the core. And then you're going to lift the pelvis up off the ground, maybe a couple inches to start off with. And in here you should feel your hamstrings, your glutes, and even your lower erectors multifidus turn on. Now we're going to windshield wiper the legs out, so the knee is going to come out, about a 2-3 count, and then back to center. And as soon as it touches, you go to the other side, making sure that your toes are still flexed up towards your knees. And typically what can happen with this when you first start is that the hip is going to drop. You don't want that to happen. You want to keep the pelvis nice and neutral, so the knee will go out just to about where the hip would drop, or even maybe a couple degrees less, to make sure that the hip stays nice and neutral. And you can repeat this 10 to 15 times on each side, making sure that you're breathing up into your thoracic cage, keeping your abdomen nice and tight.